I was excited about this money because I thought, okay, this is good. Now we can deem at least some certain pot of money to be granted for programs that, in my opinion, and I want to kind of go through what the programs are meant to be. I got excited about it. But then I got my hands on the deck and really started to dive in, and I'm a bit flummoxed. But I think there's an opportunity here, and I think that our subscribers and our kind of, I call them our people, our food is health folks. I think we could do something really interesting here, and between lifestyle medicine and food is health. But I think we've got to really be creative. The big deal is that we have a month. Grants are due on November 5th.
Should we submit some? Maybe we should put a post together on all the line items that these programs should be thinking about.
Yes, I think we should.
I'm gonna say, what?
There you go.
What measure would score the best on this criteria, and then we'll take all those measures maybe and put them on a list, and then assemble who's the expert in each one. Why don't we do that? So we'll do that. We'll generate the list of all the things we know, and then we'll send the email out to everybody and tell them to send it to their governor.
And then we should do a live event and invite all the governor's offices.
There you go. I know I've met with a few of the governor's offices. Still don't have a direct mobile number, but I think they'd be interested.
But just put all the staffers. I mean, just whatever staffers want to come and like hear about it. Like we need to. This is our opportunity.
Have to be pretty quick.
Yeah, we got to do it in the next week and a half.
Everybody could do a pitch. Like we could do this next Tuesday. Everybody could do a pitch. Here's my 5 minutes. Here are the 20 things we think would help here. And people could stand up and do a pitch, 5-minute pitch on why they're important to. Why don't we just transmit it, tell everybody to send it to their governor and director of Health and Human Services.
So this is the deck, right? I'm going to kind of go through a program at a glance. I'm going to jump into these strategic goals because I think it's important to kind of look at it, right? So this is the money, $50 billion over 5 budget cycles. $25 billion is distributed evenly amongst the approved states, and then the other $25 billion is based on other components of things. I think what's important to note is that every state isn't guaranteed this money. They have to apply and they have to be approved. So it's only the approved states that get the money, and there is a scoring system here, which I'll jump into more. Eligibility requirements. So there you go. The primary recipient of each award is a single state, and the application must come from the state government and include a letter of endorsement signed by the governor. And this is the part that has me a bit frustrated, because this is where, when you are more of a grassroots entity and a systemic change, you don't have the big lobbyists, nor should you. And so how do you get to the state governor with something compelling enough that they would want to put into their proposal? Again, pause. Don't have to answer it. But this is where it gets interesting to me. So the very first piece on this is make rural America healthy again. And it's support health innovations and new access points to promote preventative health and address root causes of disease.
Done. Okay.
I mean,
that's cool.
It's what we write about every day, right? That is first and foremost in this proposal. It's never been in a proposal. I've never seen anything in my 30 plus years in healthcare with the word root cause in it that was related to policy. So that's where we are now. Innovative. What's that?
Who wrote the doc?
CMS, HHS.
I wonder what they mean. Do you think their root cause is the same as our root cause?
I do. I don't think they see the systemic food part yet, but we can get there with them. So here you go.
That'd be double entendre, wouldn't it?
Yeah, would be. I love this though. Use funding to pay for a transformation of care delivery, improved access, expanded in services, right? Do not use funding to pay for new construction. I mean, could we make it any more clear, right? Big X. No more hospital buildings with this money.